It's 1 minute past 5:30, so I think we can start now. Since I'm just going to ramble a bit beforehand, I'm told there is no. Are we not supposed to do some fire thingy? Yeah. Well, I mean, get out if there is a fire. Yeah. Usually there is some slide we are supposed to put up, but we didn't. But just consider yourself warned. So my name is Sunita Kariala, and I'm professor of global nutrition, and I'm also the department head of Department of Population Health. Suddenly I forgot, DPH. And I see many familiar faces here, but also some new ones. So hopefully we'll get to interact during the not during the lecture, but after the lecture, which is in during the reception in G20. Again, follow us. Those of you who don't know the school, follow us, because I'll be the first one at the drinks. So, but on to the star of this lecture today, who is a dear friend, a champion of the work we do, a champion of the school, but we are also equally her champions and admirers. That's Dr. Sera L. Young, and she's a distinguished nutrition anthropologist and a Leverhulme Trust visiting professor at LSHTM. And she's from the Northwestern University in the United States. I understand that this is the first time the school has successfully, I could be wrong, but let's say even if it's the second, that we got the Leverhulme Trust visiting professorship. And that all goes to the brilliance of, of Sera here. She's a PhD in nutrition anthropology from Cornell University, and she employs a biocultural approach to investigate how vulnerable populations, particularly women and children, navigate challenges to their health in various parts of the world. Her work spans food insecurity, maternal and child nutrition, but here is where our connection actually, although I've known Sera through my HIV and food security work from before, is through a program that we lead called it's a long one called IMANA, Innovative Methods and Metrics in Agriculture and Nutrition Actions, funded by FCDO and Gates Foundation. And IMANA has a competitive research grants program to develop groundbreaking multidisciplinary tools, methods, and metrics to investigate the interactions between agriculture, food systems, and nutrition linkages. So Sera had applied for that funding for a highly competitive process. We're delighted that she was awarded that competitive research grant. And from that has really emerged her groundbreaking work on measuring experiential household level as well as individual level water insecurity. And she'll tell a lot more about how that has exploded to over 50 or 60 countries and all the cool things she's doing. So I won't give away too much on that. And Sera's work has always been multidisciplinary, as you can see. I don't know what a biocultural approach is, and I'm hoping to find out a little bit more during this. And so thank you, Sera, for being such an amazing researcher and inspiring all of us. And we look forward to your lecture.
I hope I can live up to that introduction. Thank you, Sunita. It's a pleasure to be here. I appreciate all of you coming into a fluorescent lit room at 5:30 on a Tuesday night. If this is not, it is Tuesday, is it not? Yes. I mean, come for the science, stay for the drinks. I can at least assure you there'll be something interesting after this. So it's a huge pleasure for me to be standing here. And I wouldn't be standing here if it wasn't for Amana, if it wasn't for Sunita, if it wasn't for the London School of Hygiene and Tropical Medicine crew who have done so much in supporting my work early on. They were sort of like set me on this trajectory and then continue to sort of support what we do here with the Leverhulme Visiting Professorship. So my Amana family, I thank you. Will we go wrong after that? We are ready to rock and roll. Okay, so this is a talk to supposedly a nutrition crowd. I am so happy to see that there are people from population health and epidemiology and environment and economists here. I'm still putting a nutrition bent on this, and I'm going to present today's menu. And so we're going to start the meal with just putting water into context and just sort of take a deep breath, relax. I'm here to profess at you for 40 minutes. You just let's put this into context. So in the solar system, the planet Earth is distinct from all the rest of the other planets because of the concentration of water. But even in the universe, there's no other place that has so much water that we know of yet. And that makes life possible. And it's a platitude, but it's worth repeating because it's true. The biochemistry in our body takes place in against a backdrop of water. We also spend the first 9 months of our existence floating in a pool of water. It's integral to our communication, to our temperature regulation, to nutrition. And water, most of the water that we use of the fresh water that's available goes towards food production. But it's not just food production, it's also food preparation. After we feed our children, we need to bathe their grubby selves. And on top of that, water features prominently in the major religions of the world. However, but it's not hard to see that there's a global water crisis. I mean, you open a newspaper and there are articles about water everywhere. I live this year in Cambridge. On the front page of the newspaper this week is how a housing project is not going to go through because of potential shortages of water in Cambridge, England. So there is this problem with water. And the problem is not just a question of availability, but it's also of access, of safety and reliability. It's a multidimensional problem. And that crisis has gone unseen many times. And and it's not only unseen in public health nutrition. We have paid attention to water, especially in terms of water for agriculture, and also water for waterborne illnesses, so diarrhea, of course, but also environmental enteropathy, which will be familiar to some of you. But that's not all the ways that we use water. All of those uses that you saw in those other slides where water is featuring prominently, those have gone more or less unmeasured. So that's kind of the context of water. Enter what you'll be hearing about ad nauseum for the next 20 minutes are the WISE scales. So there are kind of two types of water insecurity experiences scales. There's those that measure these experiences at the household level, and there are those that measure experiences at the individual level. Now, both of those scales are composed of 12 questions. They each take about 3 minutes to ask someone. And they're open access and translated by now into something like 60 languages. So you never have to talk to me again if you would like to use those. And this is where the sort of the fun of giving a talk begins, is I can give you some of the sort of the backdrop for how this came to be. So when you read the peer-reviewed papers, you don't get the gossip, and I'm here to give you the gossip. So 10 years ago, I was a baby assistant professor, and I had just been given a large grant, $1 million from the National Institutes of Health to study food insecurity in Kenya, as Sunitha was talking about. And with my nutrition hat on, so I'm trained in nutrition, we know how to measure food insecurity access and use. So there are 9 questions or 8 questions, depending on the scale, and those work the same everywhere in the world. With my anthropology hat on, I wanted to make sure we were asking women about the stuff that they cared about. And to my great surprise, the way we did that was we did photo elicitation surveys, which is where we give camera to a mama and we say, take pictures of that, which in this case shapes how you feed your baby. And we had a ton of photos of water, including this one, much to my surprise. But being the eager assistant professor ready to take on the world, I thought, let's measure water too. I mean, I had a pretty great study design, panel data for months, where we were measuring food insecurity at all of these time points. And I thought, if this is what women are telling me, if this is important, we should measure that too. So I went to the literature to see what you water people were up to. How have you been measuring water? And as it happened, the indicators that we found didn't really consider consumer perspectives. So I won't get too technical in this presentation, but if you allow me for a minute to talk about the 4 domains of the concept of water security. So water security is a term that is often used to cover all manner of sins. And sometimes people talk about it to refer to availability. Is there water out there? And we are pretty good, if hydrologists are in the room, they'll say, well, we could be better, but we're pretty good at measuring water, for example, in Lake Victoria. We're also pretty good at measuring infrastructure, so things we can see. So are you getting water from a tap? Are you getting water from a borehole? And so we're pretty good at measuring the physical accessibility of water. And there are many ways of measuring safety of water. Some of them are much more rapid at home. Others are much more complicated in a laboratory setting. But I wasn't looking for any of those indicators. I was looking for something that covered these domains of access, use, and stability or reliability across time. This yellow box is representing the human experience. And this was just, this was not a new idea. This is how we do things in nutrition. This is how we track progress towards SDG 2, is by asking about people's experiences with access and use around the world. Every year, Gallup poll takes representative samples from 100+ countries and estimates how many people are suffering with problems with access and use to food. I was just copying a page from the playbook of the nutrition sector and kind of putting it on, bringing it to the water sector. So going back to the mama who you saw a couple of slides ago, using standard indicators, she was water secure. So what you're seeing here is she's going to fetch water. She has someone to take a picture of her. She has a pregnant belly out to here. This is kind of head on, so you can't quite see. And who you're seeing here is her mother-in-law, far left, who is not letting her use the infrastructure that's in the compound. So she went to fetch water and went into premature labor with significant medical consequences for herself and her ultimate baby. But if we use standard indicators, she would be fine. Lake Victoria is back there. The infrastructure is there, but we know that because of political dynamics within the household, she was not water secure. So in 2018, we developed the first experiential measure that was globally suitable. That's the HY scale. And this is a work of a huge number of people. You can see a lot of them here across disciplines, across time zones, across, kind of across the gamut. And what we did was we sort of developed 32 candidate items. We implemented them in all of those 28 sites to really stress test the questions. We thought we had good questions. Some of them were good, some of them were bad and didn't make the final cut. And then in 2021, we did the same thing again, except for at the individual level. So that's the IY scale. So HY is household, IY is individual. I'm going to spare you the blood and sweat and tears and theory and gray hair that went into making these scales. It's all available, open access, just wisescales.org. You can read all of these papers. You can ask me questions about it. But I'm just going to cut to what those questions are. And they're the same question stem for each of the scales. So questions are like, how often how often have you worried about problems with water? Or how often has your water supply been interrupted? Or how often have you been unable to wash clothes because of problems with water? And you'll notice that the question is about problems with water. So we're covering water that's too much, too little, or of poor quality. You can respond that you either never are unable to wash your body because of problems with water, or often or always, in which case you score a 3. So the range, 12 times 3 is 36. We have a provisional cutoff of 12. 12 or higher is water secure. Less than 12, you are considered water secure. However, but it's not in the presentation, but it's a paper I was working on the train on the way here today. We now have levels. So we have water secure, mild water insecurity, moderate water insecurity, and severe insecurity. Just remind you that these are a short lift in a survey. So there's 12 items. It takes 3 minutes. And there's a manual that goes with them. These are the 12 WISE questions with full phrasing. Just here's a smattering of some of the translations that we do have. I'll put this back up later. I'm not going to read you all the questions. And I'm happy to report sort of from 2018 when we had the HY scale first published to 2021 in the dark days of COVID when the IY scale was published. The scales have now been implemented, in fact, now in more than 48 countries by a number of organizations. Where you see green, that's where we have nationally representative data. Where you see red, those are site-specific studies. It was really important that Gallup sort of joined the party, and we collaborated with Gallup and UNESCO to get nationally representative data. But it's really exciting that countries are now taking this up. So for example, in Mexico, the HY scale is in the 3rd year of implementation in what's called the NSANU, that's the National Health and Nutrition Survey. USAID is implementing it in what is a very USAID name, the Zone of Influence Midline Surveys. So these are probably 20 countries in which food security activities are really rapidly happening, and the HY is being used in those. But it's now been implemented in a lot of other places, and now it's happening that I see papers published using it that I had no idea were doing it. So why this uptake? It used to be because I was pushing it, like pushing a rock up a hill. I mean, I have been talking about the need to measure, to bring the human voice to the water sector for a long time. But it's not just from like, because Sera Young asked you to do it, people are doing it, they're not, and many people at, even if I ask them, they don't do it. But what we're seeing is that because it works across levels, so we can understand which populations specifically are at risk. We can understand the impacts of programs or of natural shocks or of investments. People love to calculate a return on investment. But we can also tie water to multi-sectoral consequences. And that's where it gets, I think, really interesting, and where we're seeing these WISE data bridge nutrition and mental health, for example. And so this is just kind of one way of presenting the data, like if, and you'll see evidence of this in the next course, but if you care about water security, you should measure people's experiences of water security. But we now have data tying water to mental health, to food security, nutrition like dietary diversity, to physical health like HIV outcomes, diarrhea, cholera, and then of course to human capital and well-being. And this, I think, is one of the reasons this is a real draw for the good people at the World Bank. And so all of this data together can be used to make decisions about investment, to advocate for resources, and to shape policy. And I'll show you that in the next slide. But just to kind of, this is like a recap, like, okay, she was talking about the WISE scales. Why do we care? It's because the human voice has been missing from this sector. When we're only measuring things we can see, we're not getting a picture of access and use and reliability. It predicts health outcomes way more robustly than infrastructure alone or availability alone. I mean, in food and nutrition, we used to say, how many calories are produced in a country? Divide that over the number of individuals who live in the country and say, well, there are enough calories in the United States. I don't think I need to explain to this crowd like why that's problematic. These calories, and much like butter, are not always equitably distributed. So we need to measure at the level of the individual or the household to understand who is suffering, where the inequalities are, who is being left behind. Okay, so that's 2 courses. I'm very good at talking at people for a long time. Let me pause and see if there's any clarifying questions at this point. Okay, then I'm gonna, oh yes, please.
I was just wondering, how do you kind of measure it into your questionnaire when maybe the local authority or the government has cut off the water on purpose because of scarcity? So like, I know in Tunisia this summer they cut off the water between 9 p.m. and 9 a.m. because they haven't got enough water to kind of use. Is that?
Yeah, so the question is, and I'll paraphrase, is this an appropriate scale to use when the problems with water are intermittency, and as was the case in Tunisia? Absolutely. So what this does is this measures the like static state of where people are. And people cope or adapt, or there's different words we can talk, actively manage issues. And there's like what lies beneath your water security status is the behaviors that people do in order to achieve this coping. I mean, in order to achieve this state. So this is appropriate. And if you're trying to figure out which interventions would be suitable, then you should try to get to the coping strategies. And we can talk about what some of those are. But it's first to understand if there's a problem, and then we can understand the drivers. That's a great question. Thanks. Okay. So I don't know if the word glimpses is a term, but I'm a professor, so I can just use it because I'm a Leverhulme Visiting Professor. I'm going to say glimpses, hereby a word. This is just like 7 snapshots of where we're starting to see, not like another peer-reviewed paper, which is fine, but like real evidence out in the real world. And then from there, I will take us to opportunities for next actions, and we will conclude. So one way to give people a glimpse of what's happening is what we're calling these one-pagers. So remember, we collaborated with Gallup to collect nationally representative data we're now up to 40 countries. And these are literally one-pagers that show the 12 experiences and how these play out by gender and age and income and so on and so forth. And what this does is it starts to make visible people who are being left behind or not. So, I mean, SDGs, that's the byline, like leave no one behind. But if we're not measuring at the level of the individual, we don't know who's being left behind. So for today, I picked data from Brazil, but we have those one-pagers for many other countries, and I'm happy to share them. And so let's look at the individual characteristics of those people who are water insecure. So remember, the cutoff for this is 12 or higher, and the range is being 0 to 36. We can look at this with more granularity, looking at, water secure, low, moderate, and severe water insecurity. What may or may not surprise you is that water security was similar between genders. And in the water sector, we know that water is often a woman's problem, more of a woman's problem. And sometimes it is, but sometimes it's not. And there are a couple of countries where men were more water insecure than women. We see here that people between 25 and 35 were experiencing the most water insecurity. But we can also look at, so what this tells you, though, is that this is like more precise and holistic. So we're looking at the level of the individual, and we're not just looking at drinking water ladder levels, which is what will be familiar to some of you who are familiar. I see the WaterAid crew nodding. Yeah. So this is like more holistic of issues with WASH. But we can also look at household characteristics, and I think this is really interesting. So what you're looking at here is that those with the lowest income are on the far left, and then the highest income quintile is here on the right. And as you would expect, water insecurity, the prevalence goes down as income goes up. But it doesn't go away even in the highest income quintile, which we often see with food insecurity. So there's more to say about all of this, but we can do this for each of the countries. Here are these glimpses that I promised you. So WISE, as you can now see, helps us to understand differences in gender. And so gender inclusive, some people say gender inclusivity, people say disparities. But this is from the 2023 JMP report. So the Joint Monitoring Program is a program of WHO and UNICEF. And they've come together to track the world's progress towards water and sanitation. They are the repository for the drinking water ladder, which will be meaningful to some of you in the WASH sector. And they are seeing in the iWise data that we're able to look at differences by gender that haven't possibly previously been seen. So we're paying attention to the value of measuring in a higher resolution than the household. The Asian Development Bank is also very interested in looking at these differences, and we have a report forthcoming looking at how not just water insecurity varies by gender, but we can do intersectional analyses. So we can see how gender by urbanicity or gender by age and so on and so forth. And there's some really interesting data coming out of Afghanistan that I'm happy to talk about at the end. This is a nutrition crowd. Nutrition is how I came to this, as you now know. So we can use WISE to understand food security. So remember I mentioned that Gallup was so wonderful as to implement the WISE scales in 30+ countries. Serendipitously, they asked food insecurity questions in the exact same individuals. Not just the same country, not just the same household, but the same individuals. And if you know the Gallup poll, you'll know that they also ask about age, urbanicity, education, number of kids in the household, all the things that we kind of know drive food security. So we had all those sociodemographics plus the FIES, food insecurity, plus IWISE in the same people. And what we found, and this is, I mean, it's published, you can look at the details, but this is just the odds ratios by region of the country. You can, by region of the world. So there's sub-Saharan Africa, North Africa, Asia, Latin America, and then the overall values. And what you can see is that water insecurity was associated with the 2 to 3 times higher odds of being food insecure. And that's big. I mean, in public health, we're kind of often happy with like 0.2, 0.3, 0.4. This is 2 to 3 times as high, which really what that says is like, if we care about food security, we have to pay attention to water. The WISE are also bridging, doing the bridging that I had hoped would happen. So I'm not sure how many of you track closely World Food Day. I do. Yes, other people do. World Food Day. The theme this year was water. What was it? Water is food, water is life. Like, oh, my people are coming together. It's water and food. And so what we did was we surprised, shocker, wrote about the importance of acknowledging, of measuring, acting on the importance of water and food for nutrition. But what we also were able to do is to pull together different parts of the UN system. So at FAO, we have co-authors on this, both from the nutrition group, but also from the statistics group. We have people from EMI there, and we also have a co-author from UN Nutrition. I mean, I value my fellow professors who are also co-authors on this, but when you can get different UN agencies talking and even agreeing on something, it's exciting. It wasn't easy, but it was completely worthwhile. And so this interagency dialogue, I think we can see more of with these kind of data. This may be my favorite glimpse, is that we can use WISE to advocate for resources. So a couple of years ago, I call them the Ladies of Walgett. There's an elders group just maybe 6 hours outside of Sydney who've been really experiencing a lot of problems with both food and water security. And they asked, like, would the HY scale be appropriate there? I said yes, and I told them a little bit how to use it. They went and implemented it. And what they found was that water insecurity was a huge problem in their particular community. So something like 46% of people were water insecure. That's a score of 12 or higher. And what we could put this into context, because remember, we have nationally representative data for a couple of high income countries, including Australia. We know that in Australia, the prevalence of water insecurity for the general population is 1%. So it wasn't just like, Australia, it's a dry place. It's like, wow, Walgett is really poorly off. It's one thing to, these people have been saying these stories for a long time. And they've even have data on the saline levels of the water. But somehow they didn't quite resonate the way that these experiences, like how often have you been angry about your water situation? How often have you had to change your food because of problems with water? So the 7:30 news in ABC in Australia, apparently people watch, and they, there was a big story about, and I mean, I would not have picked this headline, the Australian town where water security is felt more than some communities in Bangladesh, but it didn't just capture the public attention, it attracted the attention of policymakers. So Water Minister Rose Jackson, she looks mad in this, she took action. I mean, I'm not saying that this is a panacea and that all the problems of water and food insecurity in Walgett are sorted out, but it did catalyze action in a way that data that they had, the stories, very compelling stories that they had beforehand, did not. So things are changing. Zach Goldsmith, I don't know where he's at in the spectrum of politics these days, but he has nice things to say about the WISE data. So I'm currently a fan. So at World Water Week in 2021, he was talking about how the WISE indicators are can hold stakeholders accountable. So accountability is a good thing if you're on one side of the table. It can also be a very scary thing if you're on the other side of the table. Now, I don't know how many of you are involved in water infrastructure interventions, but it's kind of easy to, like, I wouldn't say cheat, but you can exaggerate. Like, we say, like, oh no, we built this borehole and 2 million people's lives are different because they each, had a drink from it. Or you can count boreholes. You can say, and we built 3 boreholes, case closed, mission accomplished. But that is not exactly a great picture of what's happening on the ground. So a number of organizations, like, for example, Oxfam, have used the WISE scale to evaluate the impact of, for example, this intervention in Sierra Leone. So what they could do is there was the intervention villages and the comparison villages. And you could see not only what the mean score was. So remember, higher numbers are more water insecure. You could see that the insecurity was much higher in the villages that did not receive the intervention. But the prevalence was also of water insecurity was also much lower in those that had. And don't believe me or Oxfam or Helvetis or these other organizations that use them. It's now being used in Karnataka to evaluate a big World Bank investment there to see, like, what is exactly the return on investment for this, and because counting boreholes is not precise enough. Yeah. Water also is, I say this is such a boring way of saying it, like, water insecurity is climate change made manifest. No one cares about that. But we see, but someone else at FCDO had the line that if climate change is a shark, then water is the teeth. That gets you a little bit more. Like, it's hard to see a temperature change, but it is easy to see flooding, and it is easy to see drought. And we're starting to pay more attention to that. I have a lot to learn about climate and climate change. I'm very happy to be working with some people here in Amana. Where's Claire? Yeah, where we have geospatially tagged data to look at how water insecurity and climate events kind of co-vary. We also had an Amana blog for World Food Day. Shocker, looking at the relationship between food and water and how that's modified by climate zones with Indira Bose, who helped with those analyses along with Claire, and urbanicity. And then next week I'll be in Dubai using my shark line, which people seem to like, talking about how water data can be used to advocate for action. Yeah, okay. My last and final glimpse of the utility is about poverty reduction. So you will remember that we have now nationally representative data for a number of countries, including Mexico, also thanks to the Ensenut survey. And the findings are literally making headline news. So if you look at if Mexico's data on the infrastructure would suggest that something like maybe 5% of households have insufficient infrastructure, i.e. what has been being called water insecurity. But when you look at the prevalence of water insecurity data, it's much different. Sufficiently so that states are starting to pay attention too. So I am mildly familiar with the geopolitical setting in Mexico, but even I wasn't aware of what was happening in Nuevo Leon until I saw in the New York Times that there is a drought. And it was not a little drought, it was a big drought. And it's in the same state, Nuevo Leon, where Tesla has built, I think it's now done, a factory. And there's a lot of attention on the water industrial water use and pollution that accompanies large factories. It's also a draw for lots of reasons. So the state of Nuevo León asked for oversampling in the Insecurity survey. So we prepared this, and what we found was that in Nuevo León itself, the prevalence of water insecurity was 42%. In all of Mexico, so we could put this into context with the prevalence in Mexico, it's only 16%. So that makes the government of Nuevo León pay attention. And I'm saying this, like I have said this in front of them, they have welcomed us to measure this. And then they welcomed us to the, oh, yeah, now you can see. They welcomed us to the governor's palace to sign this like agreement that they would be measuring water insecurity in their state in order to target poverty reduction activity. This is like make my mom proud picture. You can see the wise, the little drop logo in the palace. But this is now like baked into how they're making decisions about poverty alleviation and measuring infrastructure activity. So, I mean, they've done a great job responding to the drought. The drought's, I mean, it's starting to be a dry season. I mean, it's happening again. So they are collecting these data to see what's happening and who is being left behind or not. So we have 4 opportunities left, as we'll call it the dessert. And the opportunities are there because water is so important. I mean, as I laid out at the beginning, but also because there's a widely acknowledged need for better water data. I mean, UN makes lots of declarations, but this is the one I strongly agree with, that you can't manage what you can't measure. That's just true. And that's something that the UN is saying, but it's also something that people in the US are saying. So this is Senator Tammy Duckworth, nutrition tidbit for senator to breastfeed on the Congress floor. So go Tammy. She is an Illinois senator. So I've had some really great conversations with some of her staff, and her staff are saying like, you know, our data on water in the US is like a D-. As does that translate to UK grades? It's crap. And so she has written to the Center for Disease Control to say, like, we should be measuring water access and use experiences therewith here in the US as well. So this is not like a problem over there, it's a problem everywhere. And these data, I think, can help fill this gap, both because they're multi-sectoral. So if you care about mental health, we can pin water to that in some settings. And because it works across levels, so it's suitable for nationally representative studies, but also at the level of a village. And there are lots of examples of that are used there. And if you don't believe me, the journal Nature also says so, which I was very glad that they agreed, talking about how this is a very important tool for policy making. So the first area of opportunity is with international leadership. I don't know if any of you have seen like Dr. Evil, but you know, it's sort of, there's always an evil plan somewhere in for Dr. Evil. And I'll just like declare to you my evil plan, which is that I really hope in the next year or two, we will have experiences of water insecurity in all 40 countries, that this map will be painted green. And it's not so that I write, you know, some more peer-reviewed papers that like 12 people read, but so that we have like the basis for policy that we can put into context that which we're seeing in places like Walgett or Monterey, and that it's there available as a global public good in the same way that we now have for food insecurity. And I'm so happy that people besides me are saying that this is a good idea. We had a meeting in Mexico City in April, and this is the chief economist at FAO, where he's saying, like, we stand in solidarity with experiential measures of water. But there's also opportunity at the level of the country. So this is me with like crazy eyes with with Minister Luhut of Indonesia, who is the minister of many things. I can't say exactly, just like water, I don't know, And he is saying, like, this seems useful. He came to Northwestern University. He said, this seems really useful. I'm like, oh, but it can hold you accountable. He said, no, I think we really need to know this for Indonesia. And so for those of you in the water world, Indonesia is an important country in 2024 because that's where the World Water Forum will be held. And we have some data that are, reflect quite positively on Indonesia. But it's not just Indonesia where, governance can make decisions with this. I mean, there's the United States, there's stories from Brazil, Mexico, of course, and so on. The private sector too, there's opportunities there. So the UN water meeting was in April in 2020 of this year. This UN water meeting was huge, and I didn't appreciate how long it had been since there was such a water meeting. So I'm 46 years old. The last time there was this meeting, I was an infant. And suddenly we're like now paying more and more attention to water, and including, large organizations like Unilever and Diageo are seeing, both for their sort of corporate do-goodness, but also for their investments. Water is fundamental. And then lastly, there are opportunities for NGOs, bilateral organizations, and humanitarian entities to use this to guide their work, to evaluate their work, and to make decisions. I mean, we don't have unlimited resources, so we want to target where there's most potential to benefit. And I'm seeing now, like, many organizations like Charity Water is now using this as their, like, I can't remember the acronym, but they're tracking progress based on that. I had a call today with Helvetas. This is baked in now to how they are tracking their progress. So the meal is over. Port is being served in your mind. I'll just recap for you what we've done. I put water into context in the universe, in the solar system, and in our own lives. I've talked about the H-wise, household, water insecurity experiences scales, and the I-wise, individual, water insecurity experiences scales. And I've talked about their utility for understanding gender inclusivity, for understanding food and nutrition, interagency dialogue, advocacy, evaluation, and anti-poverty activities. And then I'm sort of leaving you with opportunities because we are not done. I mean, we are now starting. I mean, I would say the boring work has been done, which is scale development. No offense to anyone who's developing scales. I mean, I did it. I'll keep doing it. But what is interesting is when we get the data to understand how these such important experiences with water are shaping our mental health, our physical health, and our nutritional well-being. I can't end the conversation without acknowledging all of the wonderful people and all of the wonderful organizations who have made this journey possible. It's really just an honor and kind of a dream to be here. So thank you for coming. Thank you for spending your Tuesday night with us. And thank you, Sunita.